Obviously, a pretty crazy time right now in the medical field, and particularly we've heard some interesting things from neurologists sort of about how the COVID-19 pandemic has impacted their practice or their management of patients. And obviously the neuromuscular field is kind of a big area of concern, it seems, because a lot of these patients are obviously very high risk. So I am curious, just to sort of start right off the bat, what is your greatest concern for this vulnerable patient population in the midst of this pandemic?
Yeah, well, it's a very good question. So yeah, in my role today, I'm representing the Muscular Dystrophy Association as the chief medical advisor. We have an advisory committee of specialists who care for patients with neuromuscular disease that helps to provide guidance to the 150 MDA care centers that are around the country, where really the bulk of the care, this is the home for most of the patient community under this umbrella that the MDA considers about 50 different diseases that affect patients with inherited forms of neuromuscular disease. Particularly one of our largest patient populations that is vulnerable are those with Duchenne muscular dystrophy, for example. Most often are treated with glucocorticoids like prednisone, which provides some increased susceptibility to viral infections. And if that weren't enough, they certainly in the later stages of the disease have significant respiratory difficulty because of the weakness they experience. And so that aspect actually pertains to just about all the patient constituencies that the MDA covers, that include ALS, other forms of muscular dystrophy, like limb-girdle muscular dystrophy, facioscapular neuromuscular dystrophy, all who have weakness and are susceptible to respiratory infections.
And now, have you had any number of patients or their families express, obviously, you have your concerns, but has anyone reached out to you, to sort of be proactive about their concerns?
Sure. I think just like in the general population, families are concerned about exposure. Obviously, there's a heightened level of concern in this patient community because many of the patients are also not generally leaving the home. So those that are the caretakers who are traveling outside the home are going to do marketing or the pharmacy if they're appropriately practicing their social distancing. That leaves the individual in the home susceptible. So as long as the patient community realizes the need for hand washing and the proper precautions for people that are going outside the home, it's really at this time where there's really every state practically is underneath a watch for unnecessary travel and unnecessary interactions. This obviously puts those patients at higher risk from their caregivers.